Uru Superstores Limited ne distributor ye chirangi cha chirenkuma cha Crown Paints abo bari abarosye be chirangi nambe ye mwasense ya Kenya. Crown Paints chini go cherire meri ko bwa chirangi chinde chionsi asenge ncho bakorosye rangi ye biwangu bigoro nande komenya segikigitambe. Chirangi chi cha Crown Paints nigo chire chaina ao buna chiri cha exterior paint, oil and water based paint, undercoats, decorative paints, smooth finish na boigo textured finish echo chikonigwa asebwa ngo bya economy na premium asamagori amubuko na boigo nchirororo chamagori aigoro boigomba bwa advanced Crown Paints color mixer eyo gwetera samagoko y'abakora imirimo babwa tuchusi yenene oikorosia chirangi ao korengana no kugania kwao ayerera bwenyorere chirangi echi omesie nyumba yao na guteba ngani go korentiro mpaka sore nande asege kege kemono. Uru Superstores nigo bagotuka asamagacho Uru Complex mbarabare na Safaricom House na baigo asamagacho a JM Towers mbarabare na Credit Bank.
Kisii TV amandegere y'umuguzi
okuralia kogokwa tuichanire kuralia goko kwa mikonyego momanyi kuruka Buori Village Masakwe sublocation Marani subcounty nigare umwana Jeremiah momanyi ongeri yagusira asko bio na Regina Kirugo nigare Iseferistek Nyaboke Brian Osomo Veronica Nyanchama Johnson Nyagaka Sam Rasugu na Aska Oboy nigare mumromo abo nyagusira Osomo nyagusira Rasugu Batsheba Helen Machuki Nyasimi Henry Peter Ongeri Morara Hailin Daniel Nocharo wakaba muraba mwabonga mona Kalen Florence Margaret Josephine Joyce Jerida Rispa Dama Nelly na Gladys nigare ba mwabonye nyagosira Nyambati nyagosira Nyasimi nyagosira Ariri nyagosira Nyarezo nyagosira Miriam nyagosira Rasugu nyagosira Buari Oyoga Dorka Ann Jen Omboka John Mika Ndemo Ongeri Nyabuti Lucas Gichana Paris Joyce Grace Nyanchama Susan Kwamboka Edna Pauline Peter Simi Thomas Margaret Amoro Richard Mila Oneri Witange Oroko Buari Nyakundi Kennedy Shem Joshua Marisera Nyauma Kibagendi Esther Zebedeo Amos na Akunga Mokoyoye nyagosira Sol Chweya nyagosira Ntabo nyagosira Kala Nyaboke nyagosira Esther Ochoti Mitunda Obiri Isaac Oromba Nyachwani Zefania Omwoma Sylvester Amona Justus nigare kolera ya nyagosira Joseph Omiti na Sophie Kerubo nyagosira Mogaka Nyarango Mr. and Mrs. Mbingu nigare Semoke Mazeras Ayako Gesare Diana Rose Kwamboka George Doris Leonard Lucas Eric Onsomu Richard Nyambati Dan Nabani nigare mwana Omburi Ayata na Mary korwa Chimo Village Ivinalis Makori na Beria Mora abo bonse bari nyagosira korwa Kengoma Village nigare umwigwa onyagosira Migosi nyagosira Gitaga nyagosira Mageto nyagosira Ongera na nyagosira Momanyi abangina mokenga mona nyagosira Mugusu nyagosira Geticha nyagosira Nyabiage nyagosira Ondieki Yebongia Nyamoita Kemuma na Alice emeroberio negenderete asenka yae aria Kabuori omuchango boko mwena nigo orabe chitarike 30 mutinyo 5 na kabiro mwakoyo omubere no rusi wa senkendo ya Lenmix chitarike 30 na limo mutinyo 5 na kabiro mwakoyo na kwenigwa etarike yemo mutinyo 5 na 3 mwakoyo ekenyorokia Kabuori Masakwe sublocation Sensi Ward Marani subcounty wachakara chinsa kianda cha Maragoba korwa Kisii TV torure engora yetu
Kisii TV amandegere y'umuguzi
okuralia kogokwa toichanire koralia gokwa kwa Esther Nyagucho Nyego webureto mwaka 1933 na gokwa chitariki 5 na 3 mutinyo yo omwaka yo 2025 nigaro omwana onyegosira omenya Mutieri na nyegosira Peres Nyaira omenya nigare omurugi onyegosira Paul Onyego Ongesa nigare ngina nyegosira David James Bosiro Onyego, Trufena Muranya ata Davidson Mura Onyego, Alice Nyabonyi, Albert Onyego, Leonard Onyego, Richard Onyego amona Gladys Onyego nigare musubati umwabo ebisiba ke muntu nyauntu nyegosira Francis Nyamache omenya, James Omari omenya, Christopher Gechi omenya, nyegosira Everson omenya amona Edward Bosire omenya nigare ngina biara gochiase nyegosira Mer Bosiro Onyego, Mer Morango Onyego, Fanis Morango Onyego, Joyce Albert Onyego, Mora Mosoti Onyego, Veronica Mosoti Onyego, James Nyaboke Ototo, Nyakara Gesora amona abandi abamunyomera tenga mona Peter Nyata, John N Otwere amona abandi nigare mukamu muromo abo nyegosira Michael Omuro Ongera Ongesa, Sylvester Kanga Ongesa, Juma Ongesa, Tochi Ongesa amona abandi Estakusi Nyauntu amona abandi nigare kolera ya Paul Gisore, nyegosira Osebe Gisore, nyegosira Joshua Nyanchoga, nyegosira Benson Mwanyifa, Grace Bosibori Nyanchoga, nyegosira Johnston Murika, nyegosira Miranga amona nyegosira Otwere nigare ngina Koro Felix Bosire, Sylvia Bosire, Paul Kasim, Nemuel Ombasa Nyata, Irene Nyata, Beatrice Nyata, Amos Moranga, Lena Moranga, James Bosire Moranga, Bosire Albert Mosoti, Emily Albert, Brian Albert Nabande, Bosire Leonard, Ruth Leonard Nabande, Samuel Onchiri na Edith Onchiri abobari chinsemo cha USA Texas, Enoch Ototo, Daudi Ototo, John Ototo, Joash Nyachwaya, Sure Mose, Morara Obonyo, Bob Gesora abakoro Nyakweba amona abande nigare ngina moke Alfred Gesora Mosoti abakoro Nyauntu abakoro Kanga abakoro Nyaundi abakoro Ongera abo bakoro Mari abakoro Gechi abakoro Menya amona abakoro Bosire abakoro Siemo amona abande omuchango bwoko mwina kwae no korekane chitariki 22 omutinyo gatano na kabiro mwakoyo area Professional Center Nairobi ritukira Jumanne kujakira chinsa 10 cha Margoba abo changoye no korekana sinka yae kujakira chinsa 5 cha Margoba omubiro ye nigora sinkendu ya Mutenzuma Funeral Home abo asomo sabarora korekane chitariki 24 omutinyo gatano na kabiro mwakoyo abwe asara niwe omutinyo yo chitariki 25 omwaka oyo aria Nyansongo Village musiabano Sameta korwa Kisii TV torure engora yetu
eye Kisii TV amandegere y'umuguzi eye Kisii TV amandegere y'umuguzi.
The stage is hotter. The pressure unmatched on Next Superstar. The top 10 contestants are giving it everything they've got. Renew your subscription for 2 months on your current bouquet and get upgraded to the next bouquet for 60 days. The battle is on for the crown of Africa's next hit maker. Every performance could be their big break or their final bow. Who will rise? Who will fall? Who will win it all? Whoa. Renew your subscription for 2 months on your current bouquet and get upgraded to the next bouquet for 60 days. On the move, stream every performance live on Star Times on Star Times. Enjoy digital life.
Omuroberio werigesa bono ochirene chinguru chimbo kegima
omwanti omurigererio Kisii TV toirane naenda sense mende yerigesa rete litukolia no
aiga nigo tugotarira abaremi ao emenisiko yerogongorwa gusi
tugitari torengo kora tugiminche mwena sete abumaega nagasibireka tanga tiga about 2 years ago
obuyo wegali tangani wekuburusi bukamuke wonyora sibokumakumaka ndoro sie said asibugo chikora kwara wachiribu akamoke so chibobeka
nigo tokurigereria oboremi bw'ebimeri ao nabo igo chitugo ao umerana na Lydia Kimunto aka Obweruti
okwanchi omorigeri o Kisii TV na ramande kala ino mobisibo tambe kondo chenga manyanga omorogeri omse dige samono ya chire anodanye editinya lwa senya igoro ryo koregi aho anamalo omore bido koregi aho no omore bido chitugo ao
kiralitko ya Jumatano ense ya moneno sichabo tuko bwika chinse ibere chabo tuko Oigo nonyoro muiroroye kiralitko ya Jumanne gochakira chinse satoneno suchamambia goika chinse nye chamambia eribwe manyamange igoro yoboremi ao Kisii University kwa ushirikiano na Ram Training College sasa wanatoa nafasi za mafunzo ya courses mbalimbali kama vile Diploma in Business Administration, Diploma in Information Technology, Diploma in Computer and Software Networking, Diploma in Networking and Cyber Security, Diploma in Multimedia and Animation, Diploma in Software Engineering, Higher Education Certificate in Business and Information Technology, Higher Education Certificate in Physical Science, Higher Education Certificate in Health Sciences, ambazo wanafunzi watasoma kupitia online kutumia kompyuta zilizopo katika Ram Training College kwa kipindi cha miaka miwili.
Hello, my name is William Mukaya. I'm in charge of IT at Ram Training College. I'm also the tutor at Ram Training College. A student will be able to learn online and can be able to graduate at Eastbat University in Uganda.
Courses zingine ni kama healthcare assistant ama caregiver, emergency medical technician au paramedic ambazo zinachukua mwaka mmoja na wanafunzi watasoma kupitia physical classes. Wanapatikana Oasis Hospital Campus next door to KMTC karibu na kanisa Deliverance. Kwa mengi zaidi wasiliana nao kupitia nambari ya simu 0722444991 au 0777744491. Ine kwa beri gukurigia amachibu ya marwira beriga kugochanda senga kentambe totwara bwabono ekyagere duka ya customer based herbal clinic ya chire neri chibu ya bene asokorentera mariogo arosire kurwa semete nobo manyi weigoro na gwanchirwa gutumeka semebere ya moya banto okorwa sechinse ao buna India, China, United Kingdom, European countries, United States of America na yande kurwa sense ya Kenya. Amarioga abo nkubeni marwire ao buna chi allergies, chi ulcer, amanyinga wakaigorose high blood pressure, arthritis, asthma, diabetes, endrume, fibroids, STIs na yandamange. Banyore aseduka yabo egotoka segesoero gose main entrance ya Boss Farm Plaza egotoka katikati ya Kisii Blood Bank na Kisii Main Stage.
Intuka soma best herbal clinic toka enyombe yengia ya Boss Farm Plaza ground from no swaiga nditore muge sieri goro antu wata marioko hapo dokura marere na arthritis, diabetes, high blood pressure, ulcers na mangabo amarego itari gorire insebuya oranyara no na ekoira togo tukutera karibu
Voigon nabo kubanyoro gwetera sichi namba chesi mi 0710540968 gose 0733990052. Customer Best Herbal Clinic. Your health is your wealth.
Yorobo bweni abwange elego koro mechando yo mubirogo ika asinye gitari yeitio maternity and nursing home engobo yogo semeria no bweni bwekene nigo bakorwa huduma ao ejo kire kibirengo bigoro buna accident and emergency MCA reception outpatient na inpatient laboratory pharmacy maternity dentistry theater nutritional counseling referral services special clinics cha diabetes ne chinde chinyinge doctors consultation
Ngorokwa Roslyn KWAMBOKA gori leo mwenyagitari ase nyagitari yaitoga iga ikoroku iterio maternity and nursing home iterio maternity and nursing home igerega iga ase mochito Suneka Kisii County Suneka enige ere angene school cha iterio boys iterio girls nyagitari yaito nyagitari ngiyama ibata abanyagitari bare qualified.
Right, bia mono kigima umancho moligira lio Kisii TV karibu sana ase ensembo yengambete mambia lero nimbata muswati wikena na ase studio tukunyara kwa kulia lero mambe ya lero karibu sana ase studio tukunyara usanga asubwa mondo ke JOAN KWAMBOKA director akoro kuna Shadrack Angwenye karibu sana ase studio.
Asante sana.
Mukwane mubusi mutebi na kyokoro kwase kwarwa ky'abantu bare tukunyara ukwanere ngambe yetu mambia lero.
Mbuya mono JOAN asa mariete nchinkoro ku WHITNEY KWAMBOKA NDEMO omwana okoru Nyamira ari manga tombe.
Alright.
Nkoro ase emambia rero na ikire studio aiga inche nkokora iga gusi ase kiombe kikoro ku Tinada Youth Action Africa. So Tinada Youth Action Africa ne kiombe ego kora igasi Kenya ngima with our headquarters in Kisumu County, and we have 18 satellite offices. Kisii County being one of the places with the satellite offices. Bona igabusi chi program chiro toko kora chi nyingi lakini serero ngo chitore go kwanera program ya malaria toko kora igabusi.
Right. Guys, tuendelea kikisia tuache.
Chelele.
But they haven't talked KWAMBOKA na bantaba ngai. Why you didn't KWAMBOKA so that they can know what I'm talking about, guys.
Today I'm so happy. Ni kwapa na my namesake KWAMBOKA.
Yeah.
Yes. Abantu bange
na nengoro Nyamira. You know, guys. All right, now we're in studio with me. I'm so to you this morning. We're going to talk about malaria, and it is alarming. Aba, it is confirming. Unajua kuna time malaria iligonga late last month, and me and my kids. Hey, it was bad. It was bad. At my house nani akafuata hiyo ligi tuliona shege
pole
and sasa venye mliniambia there is a malaria rise in Kisii. I said why can't we create awareness which is umugusi narabiga kunyara konyora ujumbe but pala nyara kuchaka ngo kwa ni yuri kiombe ya Tinada. What is this Tinada, what is this? Which organization is this? Na natuba kubwatira nabono na mangana malaria.
Okay, thank you so much. Ekiyombeke kia Tinada, it is an organization that focuses on the holistic well-being of a person. For you to be here today so that you function very well, it meant that despite the fact that ulikuwa na vitu mingi, ulimanage ukaamka vizuri, ukajieka pamoja, ukachaiga gasi, na ndogo korore gasi uya. If something is affecting you in one way or the other, there is a way you will not be productive. So as an organization we look at very many things. Ya kitu ya kwanza tunaangalia integrated mental health. Tunaangalia vile uko, how you are functioning. Another integrated mental health, there are a lot of aspects we look at, which I will come back to later. We also look at issues around education empowerment, where papenye tunahakikisha kwamba wanafunzi wanaenda shule, wakienda shule wanapata quality education, na wanapata pia pia kukaa shule. Nyuma siku hizi amanganare amange, kuna magonjwa, kuna issues za finances, so we get to ensure that there's education empowerment. Tugori pia ekiombe yetu pia tukorigiria mangana ya economic empowerment, where we teach people on issues of soft skills. Ase ngejotarekero umuntu ora korega si ase obisi. Yeah, we also need people to also assist us with technical stuff, so we teach people soft skills. And above all, we look at disaster risk reduction. Amangana yabuna aya malaria, when it affects us, as we see it's rising, there is a way it affects us in one way or the other, and if it's not controlled, then we get to call it a disaster. Yeah, so as an organization, amangana naro amange tokokora. And specifically this program of malaria, it's under the program of primary health care. When you look at the Constitution of Kenya, Article 43 says that every person has got a right to access healthcare services. So amangana ya malaria yenye tunafanya hapa Kisii, we are doing it in Kisii County and Kakamega County, but it's being done in 11 sub-counties, in 11 counties. So amangana malaria, when we are doing the management, we are trying to focus and ensure that you start getting treatment from level 1 kabla ufike level 5 or say level 6 yenye gitarie itoe nene Kisii County Referral Hospital. We try to manage these cases of malaria ase viombe vietu ase tomenyete kabla tufike hospitali, so that we also try to reduce the traffic. Where it gets complicated, then mtawate abanyagitari vikiombe kuchi community health promoters. They are your first doctors.
Yes.
Unaekwa arwarete. Kuna mtu alikutembelea akajua ulikuwa mgonjwa akakutibu kwa kijiji.
In fact nilijitibu kwanza and then it backfired.
Alafu kenda hospitali. Yeah, so as we're doing the management of malaria here in Kisii County, it has been done for quite a number of years, but for some reasons the support is starting to increase because of the demand that is there, because of the malaria cases that are being reported. And so far we are working with the community health promoters. They are trained. Abanyagitari be kiombe, nowadays we've trained them so that when wagoterera chinyomba bagokora assessment, if they meet you and they suspect that you have malaria, they've been given a test kit that they can test you with. Bakokonyora nore positive, bakokorwari kutumia ile dawa zile tembe zenye wanapeana. Bakonyoranga malaria yao, sechi signs and symptoms chao, they look a little bit complicated, they cannot manage, then they refer you to the closest facility, which most of the time is a level 2 hospital. Or sometimes if you're privileged, you can get a level 3 or level 4 in your place. Yes.
Oh. Well, there is a rise of malaria. What trends are there?
Kokorigiri Kisii County, okonyora ina border a lake endemic county. Ase amachare ase Chimbunchiro. So ukiangalia Kisii County, it is bordering Homa Bay and Migori county. So most of the time we picked Kisii since it is bordering that sub-county number 1. So that means that since you are bordering, it's easy for you to be prone kupata malaria papia kukua nyingi kidogo. Bona tu achagete ko support Kisii. In Kisii, when you're doing management, as vile nilisema, we start at the community level. in regards to management. Even there is something that we call community health units. The Kobeka even your Aikumi inatengeneza community health unit moja. And Kisii tuwate 294 community health units. And unatoa chagete gukora malaria management tukachaka na community health unit kidogo. Lakini una edona roche we are being supported by AMREF Kenya. So una edona roche according to our reporting trends akarora malaria it's on the rise in Kisii County and there's need to support. So far tuna support 126 community health units out of the 294. Hii inamaanisha kwamba hata bado the numbers that we are still having, they are not at 100% coverage. Saying in Chuchi, the community health unit that we are supporting, we have community health unit that we are supporting in every sub-county. Lakini kukorigiri hii sub-county vuna Bonchari na South Mogirango, tumecover 100%. Saying in Chuchi, kukorigiri, they are very just next to Migori and Homa Bay. Yeah, so over time, the reporting trends, the numbers have really been increasing. Number one, it's because abanyagitaria babe ikejoro wenye tuna support, they've been doing household visitation. Buna bango kutarera, kuna assessments zenye wanaangalia, kuna indicators zenye wanaangalia. So in the process, buna wanatembeanga, they've been getting suspected cases. So abanyagitari ababe kenyoro, most of the time they treat uncomplicated malaria. I think utaniuliza complicated malaria ni gani. So wanatibu uncomplicated malaria. Bakonyora umungina ore morito, they don't treat, they have to refer for further management. That's ngencho. Number one, being pregnant is a risk in malaria. Number two, bakonyora abana bari under 2 years mbari cover treat. Ase ngencho inaweza kwa pia na complications zingine. Yeah, so malaria is a risk to pregnant women, to children under 2 years. Naende pia bakonyora complicated malaria. So the difference between uncomplicated and complicated, most of the time, bakorigiri a temperature asengencho ayebuna kwa chagete ko igu malaria na kia chagete mbaka gateba tigarero ni treat alafu ikabackfire okaamua kugenda nyagithari.
Guys, mbona time? Yes. Nabo kuigwa kamutuga uwati wachaka kuigwa gasiorori kwanyoranga no ebitenge mbio tegwitugoterete gutara kwago yire liberere go kunega bado yutumkendu you know nalibona uta ye malaria Lonat bwana enda pale chemist wamepatia Lonat 150 na panado tusonge mbele.
So those are the uncomplicated malaria signs. Unasikia kichwa inakuuma, ribera liko chigoro, unasikia the joint pains, pia uko iu embeo ile nyingi. Most of the time ukisikia hizi na bado unaweza ka move around, unasema ingwete bobeti ganganye ndorevu na marogo banko chiko hivu, alafu niseme kama kesho nitaenda hospitali. So those are the uncomplicated malaria sign that the community health promoters treat. Lakini kuna wakati nafika uko enyora, uko rokori, uko saori. The temperature imeenda juu sana mpaka kuna wengine wanaanza kuconvulse. Kuconvulse.
Wacha kaukekena.
Kuconvulse. Abante they even pass out. So gekoikerahu the community health promoters cannot treat because that now needs a more advanced professional help. So pale kwa vijiji zetu watakutuma kwa hospitali yenye yenye ambayo wako linked to, which most of the time is a level 2 or a level 3 hospital. If you go there, you'll still get treatment. Where it is beyond them, then they also escalate to other advanced levels. So nono chakuna siku hizi tuwate abanyagitari ase ebiombe ime reduce the traffic in our hospital, so the doctors can get to also attend to other very needy cases and not just what can be treated at the community level. Pia kwatebanga buna kwa igwete bobe okaminyoka seke mestavu that is nearby ukajitreat. So pia as we are also having the community health promoters wamesaidia ku reduce self medication nasengecho noroche kwa igwete bobe okakaganga malaria.
Only we are complicated malaria because I ended up at the hospital after finishing the dose.
So ogachaka ku treat but pia maybe so in the process you are treating me probably there was something else, and since you had not diagnosed yourself vizuri ukaenda amario gari haikukusaidia ukaenda kumefanya nini wewe mwenyewe umejipeleka hospitali. Yeah, so management that we are doing at the community, that is what we have been doing, and the more we've been doing this, we've been realizing that there are a lot of malaria cases. Kitambo watu walikuwa najitibu tu wenyewe, so this data we were not getting it anywhere, and wakati data hakuna, you know, it even affects when they do ordering for or they do planning for Kisii County. Omaite intubuna ebyo ekiombe kiatinada and many other partners. There is something we call advocacy. I cannot a donor rero siwezi convince donor atupatie funding or resources to come and give support to the county government in the work they do if we do not have data. That is very important. Okay. So over time bakarorana chinamba cha malaria chachakire ko kinaiga Gusii rende dona kateba tina da Youth Action Africa genda mokore management malaria Gusii. So now that we are here, we are really trying as much as possible to really ensure that no one dies of malaria. No malaria if it is not treated kuko itere. And it's even more riskier in people who are pregnant. Yeah. So vono tokonyora umungina oremorito naende na watechi signs and symptoms cha malaria anaenda hospitali for management. Naende abangina bare abarito mono bonchari na South Mogi South Mogirango na bonchari koi ubare eriogo rikoro ku SP Fansida. It's an anti-malaria drug that helps to prevent them from malaria. So they're given in 3 doses at 13 weeks, at 26 weeks, and at 39 weeks. So una banyagitari ababaito yekiombe una bagotara wakipatana na mwanamke mjamzito. They usually recommend enda hospitali wanaangalia kama ameshaanza kupata hii anti-malaria. Hiyo ni hospitali inapeana. So for us to ensure that this is being done, we work closely with community health promoters. We just do for them mentorship and try to see how best we can support them in ensuring that they do their work.
So what are some of the specific interventions mnafanya nyinyi kama TINADA organization?
In regards to malaria or just generally? So one of the interventions that you're doing is to ensure that we do mentorship. Mentorship for the community health promoters who work hand in hand with their supervisors who are the community health extension workers and community health assistants. So tunawafanyanga mentorship so that we ensure that even as they work competently. That is one of the things. Another thing is that we usually support them during their reporting. So that we ensure that hata hizi wakati wameenda kutembea kwa vijiji, whatever they found, they report it correctly so that if there are other people who want to come and give support, they know what to look out for.
All right.
Yes. Another thing, as an organization, we do issues around advocacy. We do also prevention and awareness. I'm telling the community about issues of malaria and the rise, and even just telling them what to look out for. So we do create awareness in various platforms. As a Chisukuru, as a Chikanisa, sometimes we usually have community dialogues asengencho in the community sometimes ntobwate abanyagitari aba be kinyoro, we are also there to give them support, and the community might not know if you're not sensitizing them. So we usually hold barazas, we usually do community dialogues, we usually do social media campaigns and all that. And then apart from just advocacy and prevention, we also do treatment. Treatment, a short-term treatment. Earlier on nilisema nafanya integrated mental health, ya ngokora therapy, counseling, as an organization. So really ukiangalia kwa community, there are a lot of indicators tunaangalia kwa community in regards to health. It could just be the communicable diseases ambayo ni kama malaria, typhoid and stuff like that. And then there is also the non-communicable. Non-communicable ni kama hizi lifestyle diseases. It could be issues to do with diabetes, issues to do with long-term illnesses. It could be issues to do with mental health illnesses. Even though ntoriko kwanerera mono ase ebyombe ito ase ngencho sometimes there are a lot of miscommunications that are usually there in the community. So people don't like coming out talking more about them, but as an organization we are out there to educate people, and when we find that you need extra support, we are there to assist you. Since some of the activities are funded, so most of the time utapata tunafanya pro bono, yani toko bakonya amlipi asengencho, there is somebody else who is paying for that service for you. Yes, like the malaria management in the community, the testing is done for free, the medication tunapeananga bure. But most of the time ukienda hospitali kwa sasa hapo unafaa kutumia SHA nogorete kwa kana. Yeah.
Now, ukurikiria no noene kere binyi benya moyo bya chitabanta balenge gote bunga prevention is better than cure. Na malaria is the same, because at the end of the day again the koreta malaria ni virus. According to science ile sini nina bwate pe ndio pia science ile ke kontumente virus ya koreta malaria. Na it can be prevented. Na prevented utumie net ekere ndio koreta ne umbu nero kuruma kwanyora malaria. Chine tinchira maganda tekwena na labda nekiombe kia tinada kunyara kokonya gusigutanga malaria gakogendera ko komenta aso ngorosi.
So as an organization directly we are not giving nets, but we are working with other partners and the county government. So even those the net distribution and all that inafanywa through the county government to ensure that it reaches for equal distribution. So Ngokoratorene county government just to ensure that there is a distribution of commodities and the nets. So some of the prevention ways is number one, there is sleeping under treated mosquito net ambayo wanapeananga routinely, and then pia abangina baribare babwata pregnant women and children under the age of 5 years old wakienda pale hospitali au lazima wapewe net, since there are risk population when it comes to malaria management. Number two, ase ayo menyete. We usually do, there are also some public officers who walk around just to ensure that norabeti aso menyete akuna stagnant water. Nende noroche bona igabuna tuarure June, bona igatore July togochi August, utapata there is heavy rainfall. And with the rainfall utapata kuna stagnant waters. Amacha haya, most of the time it's a breeding area for mosquito. Ono aso menyete make sure that there is no stagnant water. That is number two. Number three, sometimes ntobate routine spraying, indoor spraying. Pape wanakuja wana spray those insecticides so that kama kuna mosquitoes zimejificha mahali zinauliwa. Another thing ni kama kuna mwanamke mwenye kwa mjamzito, tunahakikisha ameenda hospitali na amepewa anti-malarials. Another thing is kama umetoka kwa county ambayo inakuanga na malaria, umekuja huko ama unatoka hapa unaenda pahali ambapo kuna malaria, most of the time tunakuadvise pia uchukue the anti-malarials. Naenda siku hizi ntobwatechi vaccine. chikwe gwa bana abake kuwa prevent from malaria. Yes.
Okay. Now, natasha mputa hote batoto la Kisii nsiongire kuri kanyimbo none meki anambe takanyange na hote banore kuri Mugonga town Kisii county following Fred Moga hote bakuru Nyakenyomisa secondary Mr. Fred Moga motori komo kwa mwerejo na dan matukwe hote ba ndani amokorera from Nyamanengo Kiumbu base ndani eza kunyandiko nunga kote bakuru Qatar mara kubati morobira kote banga salimia mgeni for delivering good message to the community eza kumeno mzee permanent kote bakuru nyabituma bumachoge burabo niko ndani watching live korwa Nairobi Kibera akoseba show iko fiti kabisa. Now ngobata na mara nchi skuru ne chikwere community leaders kwene kibuna mwabere mokunyara kwena no manyigoro hibinyinyi bigabya malaria.
Yes. We also work with tunafanya kazi pia na mashule where we usually empower children who also sometimes help us in doing community service. Sometimes area settlement or sometimes even in our kwa marketplaces. Sometimes unaweza kapata inche kuna venye nimejilinda lakini kando yangu maybe kuna mtu mwenye ni mzee, kuna mtu mwenye ni mlemavu. Sometimes taking care of maybe kusema uko rabi clearing the drainage system maybe tobune hivyo sometimes wanaweza kashindwa kufanya. So sometimes when we involve the children, sometimes they help us in community work or even them themselves in school. Number 2, we have to involve the community leaders. Asing incho, for example, the community health promoters abanyagitari aba bekiombe wanachaguliwa na the community themselves. Yeah, wanaka pale wanasema rero toroche JOAN na wale koba umunyagitari itu. So for them to do that, it has to be done through the community leaders, so that if there is any accountability or any follow-up, they do it through you. So even the chief barazas that we do, the community dialogues that we do, we have to involve them, so that hata wakati mwingine kama nimekuja kwako nikakwambia JOAN aigaso menyete nyasi ziko mingi hebu jaribu fieke na maybe tunakufuatilia tunaona you're not doing the changes, you're not clearing your dumping site or things like that. Unajua it's a hazard to you and to the people who are living around you. So wakati maybe wamekuja akakwambia na hujafanya, sometimes you have to even involve the community leaders to come and bagosesi okore bintu tokoko tebi okore asengenjo, so that you help yourself and the people who are living around you. So we will have to work with the community leaders to involve various institutions, because that is also other places, public places yenye tunaweza kukupata. Nisipokupata kwa kazi ama nyumbani, ni wapi kwingine nitakupata? Yes.
Alright.
Thank you so
Another
much.
thing, maybe ile mkutano ilifanyikanga na Adam pale kwa shamba la Edeni akiongea na watu. What are some of the challenges?
Some of the challenges that we usually encounter is, over time, whatever brings malaria is the female Anopheles mosquito. But with time unagundua kama imekuwa ikikuja hapa inapata the same medication, there is some resistance that comes with the medications that we get. Most of the time if the medication is misused. Kwa ulisema tukianza ulikuwa mgonjwa ukaenda ukachukua dawa haikufanya kazi, si ndio? There is a reason why it didn't work. Maybe if I do a little bit advanced, unajua ukienda pale hospitali wakikupima malaria, kuna yenye wanapima kwa kijiji wanatumia tu the normal test kit. But ikikuwa complicated ukienda hospitali wanafanya kitu inaitwa microscopy. Hiyo microscopy hata inaweza kaonyesha malaria kwa mwili yako iko how many copies iko chini. Is it moderate? Iko juu sana. That even determines the kind of medication to give you. But when you do self medication over time, maybe leo umejitibu malaria yako ilikuwa juu, umejipatia dozi ya chini, you didn't manage it well. Next time again, maybe you do that, you don't even finish your medication. So what happens? Over time you form resistant to a certain type of medication. Inafika mahali hata tukikupatia hizi tembe haiwezi kukusaidia, lazima tuanze na shindano, ndi ukimaliza shindano rudi kuanza kutumia tembe. So there's the issue of resistance, there's the issue of self medication which sometimes is not appropriate. And then pia kuna kwanga na the management, community management. It starts with me. I have to ensure that I sleep under mosquito net, a treated mosquito net. I have to ensure that place ninaishi nyasi imefyekwa, maji hakuna stagnant water. But you find some of us, I wouldn't say it laziness, but because of just negligence or ignorance, we don't look out for those things. Sasa mimi ninajua no menyete igagusi, ninajua Kisii is a malaria prone area, lakini silali chini ya net. Another thing is sometimes amariogo, sometimes kuna kwanga na shortage. That is something that happens national wide. It even happens here in Kisii. So sometimes wewe uko pale kwa kijiji, umesikia vibaya, umeita daktari wako kwa rami ile CHPO, amekuja amekwambia labda hana dawa, unasema tigare rondare ndore buna mkova denione kakesho nenda hospitali. Kidogo unasema rero ngwete buya kego tiniko genda nyagitari. So unapata you're not treating yourself. And this malaria sometimes, if it's not treated, it even starts damaging some body organs. So poor management of malaria. So some of the challenges that we're encountering is issues of commodities. It has really been a challenge. But the county government, together with the various partners, we are really working hand in hand to ensure that we sort that issue out. Currently, even as malaria is still on the rise.
All right. I saw another family, was it early this year or late last year, where there is a family in Kisii here, mtoto alikufa. Walikuwa na malaria, but walikuwa na mini neno la Mungu. Mungu ndiye alileta ugonjwa na Mungu ndiye ataponya mtoto. You get. So are there some myths and misconceptions that we encounter pale mashinani?
Some of the myths that the challenges that we encounter, number one, sometimes sometimes amekuja kukutembelea, but maybe sometimes ni mtu umezoeana naye, unasema sasa huyu John pia ni daktari. So sometimes uko like ami John hizi ni tibu, na saa hizo unasikia vibaya. So there is that issue of the community members not taking the community health promoter seriously.
Hata unipata hospitali kama daktari utakubali? Hata unipata hospitali utakubali?
Si nitakubali. And then sometimes another thing is sometimes nikikuja kwako nimekupata nikakwambia genda Nyagetembe dispensary. Uko like mimi niende kwa dispensary. So unapata unajitoa unasema. So sometimes when you also prefer to self-medicate ama uende kwa private, sometimes getting that data that in this community these are the number of people wenye tuko nao ambao hii mwezi walikuwa na malaria. When we do not have the accurate data, even planning of how to get those commodities for you really becomes a challenge. Tuseme pale kwa sub county atendaje kuconvince mtu wa county kwamba anahitaji madawa hii kiasi, lakini wakiangalia statistics kwa hiyo kijiji haifiki hiyo dawa yenye anajaribu kurequest. So unapata maybe ukienda pale hospitali unapata hakuna dawa ama hakuna hizi test kits, not because sometimes hakuna, it's because that demand is not there in that place. But when we are ill and we get to use the resources that are available, it even creates a demand for other and even attracts either other donors or other people, other partners to come and say that because of this data, wacha tukuje to invest in Kisii County. So I think also limited resources is also a challenge that really affects the commodities and the workflow.
Lakini hata mimi ndo hospitali nipate shadindo daktari. Nirudi tu nipone.
Yes. So these people have been placed there to really help and support us, and it's upon us to also make their work easier by listening to them and ensuring that we create that trust with them, because at the end of the day we are the ones who chose and placed them there to give us those services so that we can decongest the hospital and ensure that sometimes unajua unaweza kupata umekosa fare ya kwenda hospitali. Na wakati mwingine kama ninajua daktari wangu wa kijiji yangu Mimi tuseme ninatoka Githare, naweza kapigia daktari wangu wa Githare Mutebi, lero kuna venye sisikii vizuri. Saa zile vile unatembelea watu wengine, unaweza kapitia hapo unione, ama ukuje unipime naona ni kama niko na malaria. Yes.
Right. Now, what are some of the success stories what Kurumuchaka campaign against malaria?
The success stories that we've gotten so far is that number one, since there've been a very positive reporting, that also means that in regards to even doing management and even budgeting, it even makes it easier for us as partners and even as a donor and county government. So I will say that there is positive reporting. Number two, abanyagitari beito bekiombe pia wanapeana feedback that when they go to the community and they have these commodities, wame reduce self-medication. Because as we mentioned earlier, self-medication, sometimes it's not appropriate, sababu unaweza kuwa unatibu malaria na kumbe ni kitu nyingi. Unajua siku hizi kuna homa, early signs of pregnancy pia zinakuja kama malaria. And then sometimes you might be taking this medication and causing more harm than good. So them being in our villages has really reduced the self-medication. The doctors at the facilities also say that the traffic kwao imewapungukia. Yes, and because of that, we have a lot of people, we have also many pregnant women. Ngusi, tukiangalia the number of malaria in pregnancy, wale wenye wanaenda kutafuta dawa, hiyo ya inaitwa SP. Yeah, so for those, wale wenye wameanza kuitumia, the number has increased. Because if people are not coming to use it, then that means that even the supply of that commodity in this county, itarudi chini. Yeah, so the fact that there is awareness that is being done, the fact that there is management that is being done, it is also creating demand for us. Yes.
What are some of the short-term and long-term strategies when malaria is going to be eradicated completely as of
Yeah, so some of the short-term things that we are doing, as we mentioned, is providing commodities. So that instead of you just going to the hospital, because anytime you feel bad unaenda hospitali, we are also supplying these commodities to the community health promoters who can easily reach you when you are not able to get to the hospital. That is one of the short term. Another thing is creating awareness. But in the long term, we are looking to ensure that the number of people getting malaria goes down. And those who have malaria have been tested and treated. And those who have been treated, they get well, because sometimes malaria, if it's not well managed, we have, so that we also ensure that to reduce the number of complications in malaria management. And to ensure that we have zero malaria related deaths. Yes.
Partners the malaria eradication so county government and national government your program is very successful.
There are structures that have been put in place to ensure that we work efficiently. For us to get to the community, we have to do that through the county government. So the county government has introduced us to pale kwa community. We have the focal persons who ensure easy coordination of malaria management, and that the data that comes from there, it is entered into the KHIS. Unajua siku hizi siwezi chukua tu karatasi juu nilienda pale kwa community nikaandika. Kuna Kenya health informant system that inaonyesha yenye hiyo namba iko, that anyone can access and see what is happening. That is number one. Number two, whatever challenges we get in the community, we share with the county government and they're able to address it. If it's issues of commodities, if it's issues in regards to human resource kuongeza ama kufanya the management, that is where they've been coming in to give us support. And sometimes whenever we also meet hiccups or challenges pale kwa ground, they come in and really assist us. Yes.
All right. Now, what is your last message? What you say? And mono ekeremugendra the campaign against malaria.
Message important number 1, ensure that you sleep under a treated mosquito net.
Zenye tunatoa wapi?
Si zinapeanwa hospitali. In our county government hospitals, they're usually given, number 1, to specific populations, and sometimes we usually have that mass distribution of net. I think the recent ilifanya was sometime late last year, early this year. Yes, we usually have those mass distribution of net. So mimi nikikuja kwako nikuulize namba ya household yako, kuwa mwaminifu uniambie yako ni ngapi, so that even as you're doing planning, we do the accurate planning. That is number 1. Number 2, ensure mali penye unaishi kwa rabi ribuya, kama kuna any stagnant water, the drainage system is well. If there is any pali penye unatupa uchafu yako, hakikisha umeitengeneza iko safi, because those are breeding areas. Number 3, ensure that kama uko na mwanamke ambayo ni mjamzito, hakikisha ameenda hospitali na anapata zile anti-malaria drugs zenye wanapewa hospitali, ambao wanapewa at 13 weeks, at 26 weeks and at 39 weeks. Lakini hata kama alikosa, tuseme hata saizi yako 30 weeks, akienda bado hospitali atapewa. And lastly, we also need to ensure that we work hand in hand na wale madaktari ambao sisi tulichagua kwa vijiji zetu watusaidie wakati atujihisi vizuri. Thank you so much.
All right, asante sana. So kunyara wocha studio. Nebo kwata magoka masatonde tereti saki, tonde tereti neti, tonde tereti nende. Gitabu. Mana kwata gitabu iki na keso kuna mapema ngosome sati. Ngati nada initiate grow sustain. Lakini tonde tereti. Tali mangana. Na bongo hili.
Yes. Thank you so much.
Ujumbe ya uchase kiombekia banyakiombekia so kwa neno na habari kwa kubolera mambo ya leo.
Thank you so much. I would just like to say obviously ito noere igagusi Arida Raja adjacent to Mash Park, just next to Shell petrol station. If you have any concern, any queries, our offices are always open. Again, as I mentioned, that we ensure that every person enjoys quality health care and services. As we always say, there is no health without mental health.
All right.
Thank you so much.
Thank you so much. As we know, studio mbia muno director Shadi so kunyara kusangana into mambia lero na kunyara kwende kibuno moligiri yo biriga kunyara kunyora chibicha amuna maliga senchira yugo ikirano. Asante sana okogenda kwani abantu bonse bati nada organization manira maiga sana na ayo Kisii TV weekend ya chakire director Shadi mbia muno soko bwatera mwanzi kuru Jumatatu mpaka Ijumaa. Jumatatu yende na tunachukunyara komera nasiboniga nyasayo yo twari weekend ya. Thank you so much. Bye bye.
Bye bye.
Tanga na intwe aso mutandao wetera